Good morning, welcome back. I'm Mabel Jong. You're live here at the World Healthcare Congress in Washington, D.C. And we had our Health Value Awards ceremony last night, and we're going to get more details about that from Fred Goldstein of Accountable Health. Thank you so much for being here.
It's a pleasure, Mabel. Always great to come and talk to you.
Now, tell me about the Health Value Awards, and also the Health Value Institute is now the umbrella over the Validation
Correct.
Institute. Is that right?
Yeah, so the Validation Institute was actually picked up by an organization now called the Health Value Institute, and they have the Validation Institute, which does the reviews and validations of organizations that are seeking to show that they actually improve outcomes and reduce costs for employers. And the Health Value Institute oversees that, and then also has the Health Value Awards, which were done here last night at the conference.
Okay, and give me an overview of who won those awards.
So it's a really interesting competition. As you know, we did it last year, and this is the second year now, and we have a large number of categories that employers can apply in a small, medium, and large group setting. And then you have organizations that have certain products in a certain area. Say they do musculoskeletal work, or they do a program in radiology management, or a TPA, or a health plan. And so a lot of organizations, I mean hundreds, submitted applications. Those initial applications get a pre-review, and then a certain group of those were selected as finalists. And those finalists in each category then went through a validation, and then were reviewed by some judges, a group of judges, excellent individuals in healthcare, who then said, this is the award winner in these categories. Now, obviously they had to meet standards. Some categories ended up not having award winners. It's a very rigorous competition to help employers begin to say, I can select a vendor that actually creates value to me and my employees, that will show improvements in health outcomes and reduce the cost, which is what we're all trying to do.
Absolutely. How significant is this win for a company that may not have been on people's radar before?
I think it's really significant for a number of reasons. One is it allows them to differentiate themselves, obviously, from the rest of the crowd, because we have a lot of claims made in healthcare, yet at the same time we keep seeing quality doesn't seem to improve, costs continue to go up, and yet people are claiming all of these things. Our product does this, or our company does that. So by bringing together all these different companies and then actually validating it, that's one thing to say, allow them to stand out. The third piece that the Validation Institute is launching is called the Exchange, which will allow these companies and others who show that they do good work to connect with employers, and it's launched online, and it'll be a way for employers to find these organizations maybe they're looking for with a specific product that will help them and their employees improve their health and reduce their costs.
How big an opportunity is that?
Well, I think it's large because employers are really beginning to say, we've had enough. We're going to do something. You know, we see the Amazon, Berkshire, Chase stuff that happened last year, and you're now beginning to see employers step up and say, I'm not just going to look at what the health plans are bringing me, but what else is out there that I could potentially bring in or add to that, or create a completely separate health insurance product that will actually solve my problem, which is rising costs and poor quality.
Are you encouraged by the pace of change as we see it in healthcare now, Fred?
Yeah, I think we're finally reaching, I wouldn't say a tipping point per se, but I think there's enough emphasis out there from employers. You're seeing places like Montana, the state, go out and reference-based price with their hospitals and say, we're going to do this. You're seeing that same idea happen in North Carolina for their employees. You're seeing the state of Utah with 160,000 employees in their health plan doing things like allowing their employees to go and actually pick up expensive drugs in Mexico through a validated and certified pharmacy that saves thousands of dollars, and they pay the employees to do it. So it's becoming more obvious to employers that there are options. The Validation Institute and the Health Value Institute and that Exchange is a way to highlight those companies that really do it, and then to allow employers to find them.
Okay. It's always great to see you here at this meeting, Fred. What keeps you coming back to the World Healthcare Congress?
I think the diversity of what you see in terms of presentations, as well as the people. So you really get an opportunity to network across the spectrum, from policy to hospitals to health plans or providers to brokers, and then the presentations really cross a lot of topics. So you may be focused, like myself, maybe in population health or employee areas and that, but you can hear from other areas and get some really unique insights.
Anything else you want to leave with our viewers today, Fred?
I think if you get a chance, do go to the validationinstitute.com, take a look at the website. There's a lot of neat stuff going, and hopefully this will help as we try to fix the healthcare system.
All right, Fred Goldstein, thank you so much for your time.
Well, it's a pleasure. Thank you.
And thank you for watching. Stay tuned. We have many more interviews to come.